Diabetes can be stressful. Scratch that. It is stressful. It's frustrating, it's relentless, and can have a serious impact on your mental health.
But the good news is, one, you're not alone, and two, there's something you can do about it. Today, we're sitting down with renowned diabetes psychologist, Dr. Bill Polonsky, to talk about the most common issues with diabetes mental health, diabetes burnout, and what you can do about it.
I'm Dr. Steve Edelman.
I'm Dr. Jeremy Pettis.
And we are taking control of your diabetes.
All right, so here we are with Dr. Bill Polonsky. So Bill, Steve and I were just talking. Diabetes drives us nuts. I mean, literally 2 seconds ago, Steve's CGM went off. His blood sugar was high again after lunch. And you said it made you mad. So diabetes is frustrating. But when is it frustration? When is it diabetes distress? When is it burnout? When is it depression? Like, what do these things mean?
Well, let me make it as clear as I can, and we'll do it quick. Okay. So depression, it has a biological part, but it has a cognitive part or emotional part. And really what depression is, that emotional part, is when you feel powerless. You feel like bad things have happened to me and there's nothing I can do about it. And our best evidence suggests serious depression affects maybe 15% of people with diabetes around the world. Now, diabetes distress, very different, because it's really about, well, also feeling powerless, but feeling powerless about diabetes. Diabetes is not cooperating. You feel like terrible things are going to happen to you in the future, or your blood sugars are up and down right now and nothing you're doing seems to work. So when you get aggravated about diabetes, it's about feeling powerless, aggravated. That's diabetes distress. And that's extremely common. In fact, I doubt you're going to meet anyone who, if you ask the question, what's one thing about diabetes that's driving you crazy, will stare at you and go, gee, I can't think of anything, right? So it's very, very normal. We know that elevated levels of diabetes distress, problematic levels, is probably at least 50, maybe 70% of people with type 1 and type 2. So that's very different from depression, very common, and you address it differently. Finally, there's diabetes burnout, which we could think of as at the extreme end of diabetes distress. When you're so overwhelmed, fed up, freaked out, that you kind of disengage from the stuff you got to do all the time. And you really just say, screw it.
Yeah.
Well, I get burnout and I still don't say screw it, but it's a combination of distress and burnout. And, you know, Bill, before Jeremy was born, all the publications in diabetes said the rate of diabetes depression is 6 times higher than people without diabetes. And as you discussed in our podcast that we just did, it definitely is not depression. It's more diabetes distress. And I'll just say that there's a continuum. And, you know, some people, it affects them worse than others. They get to that burnout stage. They don't even bolus anymore. And that's sort of one extreme for me. And the other end, just say, shit, I've eaten the same sandwich from Mendocino Farms. I still can't get it right.
Yeah. And then you said, like, obviously we treat these things differently. So should we give somebody with diabetes distress a antidepressant?
Well, you could. It won't do anything. Other than maybe cost them a little money. And that actually is such a very common issue that we really want healthcare providers to understand. And that's why it's so important to realize how different they are. If you're staring at someone who's just in tears because diabetes is driving them crazy, the odds are very good they don't need to see a psychiatrist for antidepressant medication. They need help to deal with how diabetes is driving them nuts.
All right. Well, I'm feeling better already. This is super common.
I'm not mad anymore.
Okay, good. A lot of people have diabetes distress, and that's not, we can't just say that's depression, go see a psychiatrist. We need to address this specific issue of it's stressful dealing with diabetes. So if people are listening and they're outside of the San Diego area, so they can't come and see you, what resources are available? Like, what can people do about that?
And by the way, you're pointing to the good news, which is we know that diabetes stress, diabetes burnout is something we can help people with and they can feel better and do well. So reaching out for help is really critical. If they're looking for professional help, probably the most important thing is to go to the American Diabetes Association website and look for this wonderful thing they have there called the Mental Health Registry. And all you have to do is find that, you put in your zip code, and it'll tell you about whether there are diabetes knowledgeable mental health professionals in your neighborhood who you can reach out to and see if that's someone who might be able to help you.
Bill, mention real briefly the diabetesdistress.org website. Sure. That can help people determine how badly they're hit by diabetes distress.
Yeah, if you want to know if that's really an issue for you, the website is, just like you said, diabetesdistress.org. It is completely anonymous. You go there and When you go to the website, it'll guide you to how you can fill out one of the diabetes distress questionnaires. It's automatically scored for you. It'll explain what the results mean. And it can tell you like, oh yeah, I guess this is a big issue compared to what it might be for other people. And maybe it'd be worth pursuing this more and finding out more about what I can do. It's worth pursuing because it is always something that you can resolve and you can feel better.
And that's so important. So a way to know that if you really are in distress, some kind of objective measure, some resources for reaching out to a professional, and then maybe leave people with your website, information that they can get there.
Yeah, and of course we have things at our website, which is behavioraldiabetes.org, Behavioral Diabetes Institute, and we have all sorts of fun things and informative things for folks in terms of our diabetes etiquette booklet. We have information for people with type 2 diabetes who are overwhelmed. We have something called the Don't Freak Out booklet, but just nice things that you can find that as a good start, like you guys do, we think somewhat amusing start to try and take a look at some of these issues that don't get addressed very, very often and very well.
Yeah.
That's awesome.
Thanks, Bill. So, we want to hear from you guys, and we often ask for comments on, does this ever happen to you? But of course this happens to you. So maybe let us know about the craziest things, or the things that like just drive you the most nuts about diabetes, and what maybe has helped to improve it or not. And the takeaway here for me is that this is really common. This happens to pretty much everybody with diabetes. So you're not alone, and there's definitely things that you can do about it to re-engage with your diabetes and generally just be a happier, healthier person. So hope you've enjoyed this. Be sure to check out, our website, tcyd.org, or our YouTube channel, or the podcast that we just did with Bill. And hopefully we will see you on the next video. Thanks again, Bill.
Be happy.